moving into postpartum. So postpartum is that period after you have your baby. And a lot of people think of this as the first 6 weeks postpartum. And that is important because that's like when you go and have your doctor's follow-up appointment and they kind of clear you. The first 6 weeks is where a lot of postpartum complications can happen, and that's both physically and mentally. But really, postpartum, I've done a lot of polls on social media, and most women take 6 months to even a year to start kind of feeling like themselves, and postpartum complications, especially mentally, can happen well past the 6 weeks. And I'll dive more into that when we do talk about postpartum complications, but I just wanted you to have that in the back of your mind as we go through this, that just because you're bleeding and everything like that is done doesn't mean that you're necessarily out of the clear postpartum wise. So after you deliver your baby, you're still going to need to deliver your placenta, and that was the organ that your body grew to give your baby all the nutrients while you were pregnant. And your placenta should come out in one whole piece. It shouldn't come out in a bunch of clots. And if it doesn't come out in one piece, they do something called a vaginal sweep, where they kind of go in and scoop out, I know this sounds really bad, any extra that is left behind. They will also do this if you have excessive bleeding. They'll also get out any kind of clots that may be happening. Your placenta, you should deliver in about 20 minutes is what most hospitals go by. Some people take up to that time, and that's normal, and some people do it a lot faster. You should birth your placenta. It shouldn't be something that's yanked out. Like I said, your placenta should come out in one piece, and the provider will look at it and just kind of make sure it looks normal. I've attached a picture in here of what a normal placenta looks like. And if for some reason they're concerned about it, we'll send it down to patho and have a doctor just look at it and make sure everything looks okay with it. This is one of those things during COVID, actually, we had a large amount of people whose placentas just looked weird. It was these weird things happening with the placenta or the cord, and we were sending a lot of things off to patho to see what was going on. And while I wasn't travel nursing at the time of this, since travel nursing, I've asked a lot of people about it, and it was happening kind of all over the place. So sometimes if you have some kind of sickness during pregnancy, it can implement the way that your placenta is grown. So that's something to just kind of keep in the back of your mind. From the cord blood, we can go ahead and also test baby's blood type here. And I'll talk about this a little bit more in the jaundice in the ROGAM section, but we can test your baby's cord blood and find out like what their blood type is. And also if they had any kind of their heart rate constantly going down during delivery, which is kind of normal during contractions, for it to go down some, but it should come back up. But if they were constantly having downs and not coming back up as quick as we would like, then we may be worried about the way that your baby's oxygenating. And so we can always send off a sample of blood to lab for that as well and check their pH and just see to make sure that they weren't compromising too much. Now, if your baby comes out and they're totally fine, it may not be something that they do, but if they are worried about it, they can go ahead and send that. Speaking of your placenta, you can do whatever you want with your placenta. It's yours, you grew it. You're allowed to do whatever you want, right? And the hospital will give you a couple options. And this is something we'll talk about when you first come into labor and delivery. It'll be one of the many questions they ask you. What do you want to do with your placenta? A lot of hospitals do have a donation program. And if not, you could always choose to go about this by yourself, and the company can like send you a package for you to send off your placenta too. But what they do with the placenta is they can use it for different things like burn graft victims, different pharmaceuticals, even cosmetics. Some people feel really good about donating their placenta, and that's something they want to do. Other people, they don't really like the company's values and what their placenta is being used for, and so they choose not to do that. They may take it home with them, or they may have us send it off to biohazard waste for it to be destroyed. You can also, like I said, take the placenta home with you, and you can do whatever you want with it. A lot of women do encapsulate their placenta, and so it's like dehumidified, put into little pills, and they just take it every day like a vitamin, like you would take any kind of pill. And a lot of women say this just helps them during that postpartum period to where their hormones feel a little bit more regulated. It helps them just feel like they have more energy, those sort of things. Some women will like cook it up and stuff like that, but that's up to you as of what you want to do. Now, always talk to your doctor about this, but if you did have some kind of infection with your placenta, or if it came out and something just looked wrong with it, they may advise you not to ingest your placenta if things like that were happening. Other things you can do is, I have a picture in here for you of artwork that you can do with it. So kind of like how you would take a sponge and you would put paint on the sponge and then you would put it on a canvas or a piece of paper. You can do the same thing with your placenta, and it kind of makes just this cool different picture that you're able to do. You kind of looks like a jellyfish too, or even like a tree of life. Sometimes people will plant their placenta with a tree for like a tree of life thing as well. Maybe they just take cool pictures with it, like the one where it's attached to their baby, and even like make a little heart with the cord, or like make it write out love or something like that. So that's an option that you have as well. Whatever you choose to do with it is totally up to you and what seems right to you at the time. I will say, if you are choosing to take your placenta home, most hospitals want you to take it out within a certain amount of time. They want you to bring in your own cooler, and usually they say before you go over to the postpartum side, after you leave the labor and delivery room, usually about 2 hours later is when they would like you to get rid of your placenta, take it home, or choose for them to use it for donations, or choose to send it to biohazard. So keep that in the back of your mind. Whatever you want to do, totally up to you.